Hey everyone, Professor Davis here, and we are going to dive into the digestive system for our medical terminology lecture today. So when we take a look at the digestive system, let's look at what the functions of the digestive system are. The digestive system is going to focus mostly on ingestion of food and digestion of that food, followed by absorption of the nutrients and then elimination of the waste. So it's kind of almost like a four-step process. We have to take the food in. We then are going to digest it into parts. We have this digestion in two ways, chemical digestion and mechanical digestion. Mechanical digestion is going to be where we are breaking things down by movement. Okay, like so chewing or churning or peristalsis, which you see here, which is the rhythmic moving of the muscles of the food through the digestive system. We also see then you're going to have the chemical breakdown of the food where we're going to break down the large carbohydrates, large proteins, large lipids into their building blocks so that they can be absorbed into the blood. And the absorption of those nutrients then can go to all of the parts of the body. What can't be digested then needs to be compacted and removed from the body as the elimination of the waste. So when we're looking at digestion, there's going to be some organs that are very important and key in this. And so the mouth is going to help with the whole idea of ingestion of food. We have your teeth, your salivary glands, your tongue, all that kind of stuff. We see that the food travels then from the mouth to the stomach by the way of the tube in this area, which is going to be the esophagus. The esophagus is going to connect to the stomach. The stomach then connects to the small intestine, then the large intestine, and then into the rectum where we remove the waste. All right, and so this is kind of the progression through. And these are considered like the main players or the main organs of the digestive system. However, there are some accessory organs that are part of the digestive system that also are going to help. And so these are going to be things like the pancreas, the gallbladder, the liver. They are going to be kind of accessory, but they're going to play some key roles in part of this digestion. So this includes in aiding in the chemical breakdown of the food. They do produce a lot of enzymes and things like that that help with the breakdown of the food. Filtration of the blood is going to be part of this with the liver. It gets first shot at the nutrients and stuff, kind of detoxifying and seeing what is available. Breakdown of the toxic compounds, like I just said, with the detoxifying. Storage of iron and some of the vitamins. Okay, so we see that they may store away some of those things. Synthesis of plasma proteins and regulation of blood glucose levels. So these are all examples of things that are going to help monitor and look at these accessory type of structures. So digestion and nutrition, word parts that are going to come into play a lot of times when we're talking about the digestive system. You can see that we have dyspepsia. Dyspepsia is thirst. Orexia is appetite. Pepsia is digestion. And stalsis is contraction. And so if you look here, thirst is the desire, of course, of fluid to drink, especially things like water. Not only does water serve to transport food, but it's going to be important for a lot of our chemical reactions. So water is really important. The normal desire for food is called your appetite. Okay, normal digestion is called eupepsia. So if you have normal digestion, that's what we would call that. Peristalsis was talked about previously, and that's the rhythmic contractions of the muscles of the digestive tract. On the other hand, when we're looking more at certain substances, we see things like amylo. This is for starch. So you might see something like amylase, which is an enzyme that breaks down starch. Bili or chole, and this is going to be bile or gall that is made. This is specifically a type of chemical that is produced that's half waste product, half digestive enzyme. And so it does help emulsify or digest fats, but it's also a waste product that gets into the digestive system to then be eliminated by the digestive system. You have glyco, which is talking about sugar. So glycolysis is going to be the breaking down of sugar. You would also see things like glycogen, and that's how we store the sugar in our body. We have lacto. Lacto is a milk sugar, so like lactose is a milk sugar, whereas lactase is the enzyme that breaks down that sugar. Lipo or lipo is going to be for fats, and proteo is protein. All right, so these are some of the substances that we would talk about more for nutrition. All right, so continuing on with the nutrients and chemicals, we do see that carbohydrates are the basic source of energy for human cells. Your cells are kind of lazy in the sense of how they break down food, and so carbohydrates are the easiest form. All right, these include sugars, Okay, so again, glyco is for sugar, and then starches, which we would see for amylo. Proteins are another macromolecule that your body needs. We need those building blocks of amino acids that are going to help bake proteins for us and what we might need. And then, of course, fats are the lipo, and this is going to be, of course, an energy source. We also see that fat is really important with like in our body for insulation and protection. And so these are going to be those nutrients. Again, to break these down, we would see things like bile, so bili or chole. These are going to be for breaking down. It's a digestive chemical. And some enzymes, when we see enzymes, most of the time they end in ase. And so you have lipase, that breaks down fat. Lactase breaks down lactose, sugar. Proteinase is going to break down proteins, and amylase is going to break down starch. So the digestive system is broken down into kind of sections, kind of like what we saw with the respiratory system where you had upper and lower. We have something kind of similar. We have the upper GI tract, then you have the small intestine and the large intestine. And so the upper GI tract is going to deal mostly with the mouth, the throat, or what we call the pharynx, the esophagus, and then down to the stomach. And so some of the terms that you would see here are oro or stomato, which is for mouth. Pharyngeo is for pharynx or throat. Esophageo is for the esophagus, and gastro is talking about the stomach. So we've seen some of these kind of root words combining forms in previous chapters, especially in chapters 1, 2, and 3. And so this just reinforces that they go with the digestive system. We then have the small intestine, and the small intestine is going to be where most of the absorption takes place for our nutrients. Digestion is occurring too, but it's mostly the absorption. So you have intro, which is going to be the small intestine. Duodeno is going to be talking about the duodenum. Okay, it's a particular part of the small intestine, and it's the first part that's connected to the stomach. Then you have the jejunum, and this is the next part after the duodenum. Okay, so we have duodenum, jejunum, and then the ileum. And the ileum is going to be the last part of the small intestine, which then connects to the large intestine. The large intestine also can be known as chole or colon. Okay, so like when you see colonoscopy, it's a picture. We're going to be going in a procedure of taking a picture, looking in the inside of the colon. Recto is talking about the rectum specifically, and ano is the anus. Okay, so these are kind of our sections of the digestive system that we see. So let's kind of talk about these in these groups, and we're going to start first with the combining forms that we see with the mouth. So we do see with the mouth, it is going to be composed of two of our bones. We have the maxilla here at the top, and then you have the mandible. The mandible is the lower part of the jaw, and it is the part that moves in order for us to be able to chew. We call that mastication. The mouth, when we look here, does also have an upper and lower dental arch, where this is where our teeth are located. So a complete set of 16 teeth in each of the dental arches for a total of 32 in an adult. The figure does show the teeth of the lower jaw or mandible arch. The 8 teeth on each side of the dental arch make up a quadrant, and so they have the quadrants that are present. When we look at teeth, we do see that you have 2 incisors. We also have 1 cuspid, 2 bicuspids, and 3 molars. Okay, and that's going to be in each of those kind of sections in that sense. Anterior teeth generally fall out and are replaced sooner than posterior teeth. So the front teeth tend to fall out quicker in kids and are replaced more than the back teeth. They are later in life. The last molar posterior to all the teeth is called your wisdom tooth. So the very back ones are your wisdom teeth. A lot of people have to get these pulled because they don't come in correctly, or maybe you don't quite have the room in your mouth for them. So some of these terms that go along with the mouth are going to be denti, dento, odonto. Those are all dealing with teeth. So the dentist is who you're going to go to for your teeth. If you study that stuff, it's dentistry. Gingival is gingivae or gingiva, which is going to deal with like inflammation or gums. And so like gingivitis is inflammation of those. Glosso or lingual is talking about your tongue. Mandibulo is the mandible, the lower part of the jaw. Maxillo is the maxilla, the upper part. Solanato is going to talk about the salivary gland. All right, so then the next one is part of the upper digestive system as well, and this one's looking a lot more at the stomach. But before we get to the stomach, remember it does start in the oral cavity, going then to the throat, which is the pharynx, traveling down the esophagus, and then we finally get into the stomach. Now with the stomach, you're going to notice there's two main openings. We have an opening coming from the esophagus. This is going to be the post-esophageal sphincter. So it's going to be right after the esophagus, and we call this the cardiac sphincter. We also have one that's going to be in the lower part, which is going to be the opening from the stomach to the small intestines, and this is known as the pyloric sphincter. Now, the sphincter, guys, is going to be a set of muscles that can close off. So once food enters into the stomach, the top one can close off, so food, as it's churning and moving, doesn't go back into the esophagus. Now, we know that doesn't always work because we do see that people have what we call heartburn or what we call acid reflux. Once the food is done digesting in the stomach, then the pyloric sphincter opens and we send the food down into the small intestine. Now, there are 3 muscle layers that are present in the stomach. We do see most of the other structures in the digestive system only have 2 muscle layers, but the stomach does have 3. The stomach ends with the pyloric sphincter, which regulates the outflow of the food from the stomach to the duodenum, which is the first part of the intestines. We also see that there are a lot of these like folds that are happening inside of the stomach. Those folds allow for stretch and accommodation of the food that you eat, and it's known as the rugae, and so it's going to be where it allows for expansion. We do see too that the outer layer of the stomach is known as the serosa, and the serosa has like an outer protection around it. This is going to be part of the visceral peritoneum. So just like we saw how the lungs were covered with the pleura, the visceral pleura that covered the lungs, there is a similar structure that's going to cover the stomach, which is called the peritoneum. We also see that the inside of the stomach has a special structure with the mucosa, where it's going to have a mucus layer to help protect it from the acid that's being produced. Now, if we move to the lower digestive tract, we do see that your intestines or your bowels can be anywhere from 24.5 to 28 feet long in total, like if you lined it all up. Now think about it, a lot of us are nowhere near that height, and so it's all folded up and kind of compressed in there into our abdomen. The small intestine alone is about 20 to 23 feet of this, and the purpose of it being such a long structure is to allow for maximum absorption of the nutrients that you consume. So the small intestines does finish up the digestion process. The stomach is going to be where a lot of it does take place. And again, it absorbs the nutrients. It's going to pass that into the blood. We do see that the small intestines does have the 3 parts. And so we see the duodenum, the jejunum, and the ileum. The innermost layer again here in the small intestines is going to also be the mucosa and the submucosa, again having a mucus type layer to help move the food forward. We also see that there's going to be lots of folds and kind of finger-like extensions that are called villi. And the reason, guys, is to increase the surface area for absorption. The more places the food touches, the more likely we're going to absorb the carbohydrates and the proteins, as well as fats. So it's kind of like if you take your hand and you were to trace it, there's only so many kind of areas or surface area around it. But if you were to open up your fingers, this tracing becomes a lot more elaborate because it increases the surface area, points of contact of that food, right? And so that's important for the absorption part of this. We also see that the outer layer is going to also be the serosa, which is going to be, again, that visceral peritoneum that we saw also surrounding the stomach. Now, the large intestine is not going to be as long as the small intestine, but the reason we call it the large intestine is because it is larger in diameter. So the tube of the small intestine is smaller, even though it's longer, and the large intestine is going to have a larger opening, larger diameter. It is going to be shorter in length than the small intestine. All right, so let's talk about some of the large intestine combining forms that we're going to see. We saw colo or colon is the large intestine or the colon. Ceco is going to be the cecum, which is this kind of blind end of the beginning part of the small or the large intestine. We also have the appendo, which is going to be the appendix area. There's a special little structure down there at the bottom of the cecum that is the appendix. Procto is going to be the anus or rectum, and so proctology is the study of that. If you have to have a sigmoid is part of the sigmoid colon, which is this part that kind of makes this S-like bend in the later part of the colon or large intestine. So diverticulo is going to be like diverticula, and this is going to be where stuff gets kind of embedded in the folds of the intestine. This can cause inflammation and cause problems where it gets kind of stuck in those folds. Now, ultimately, the colon is going to be finishing up the idea of absorption. There's going to be a little bit of absorption here, not a lot. There's not going to be much digestion at all. Digestion is pretty much complete here. But we do see that this area is going to help in compacting the waste, making sure that we take the water out of it that was used for digestion and we compact it. And this is going to create the feces. And defecation is going to be the actual elimination of that feces out of the rectum and out of the body. So if we take a look mostly at the large intestine, you're going to see that it absorbs water. It's also going to absorb some of our electrolytes like sodium and chloride. We do see it does secrete some mucus. Bacteria also is going to be in here, and bacteria is really important in helping produce several vitamins from these this last little bit of the nutrients or food. And then of course then it's going to help force out and expel the feces. The next thing we want to look at are these accessory organs specifically, things like the liver, the gallbladder, the pancreas, and the salivary glands. And so they are accessory organs because they produce substances that are for digestion and absorption of nutrients. But these organs do lie outside of that actual digestive tract that we see, because technically it's its own tube from start to finish, from mouth to anus. These guys are outside of that tube. Okay. Now, when we look at this, they do secrete a lot of chemicals that help with chemical breakdown of food. The liver is going to help with creating the bile. That's what it does. The gallbladder is going to store the bile, and then it's going to place it into the small intestine to help emulsify and digest fats. The pancreas is going to produce a ton of enzymes. These enzymes are going to be dumped into the small intestine to allow for the breakdown of food. But the pancreas also has an endocrine role. It does produce several hormones, specifically insulin and glucagon, which are going to regulate your blood glucose levels. And then the salivary glands, of course, produce saliva. So if we take a look at this, you can see here that we have cholecysto, which is going to be the gallbladder. Choletico, it's going to be the common bile duct. Hepto is the liver. Pancreato is the pancreas, and salino or salio is the salivary glands. All right, and so these are going to be some of those kind of combining forms for these particular accessory organs. So again, what would be pertaining to the liver? What term? It would be hepatic. Okay, because you have hepto for the liver and itic meaning pertaining to. So hepatic is pertaining to the liver. All right, so going along with this idea with the liver is going to have a couple of functions. It's going to produce bile, of course, and store it in the gallbladder. It's going to help with lipid metabolism because of this bile. It's going to synthesize plasma proteins. So these are proteins that are found in your blood. And so when you go give blood work, a lot of times they'll say, I want a complete blood workup with the liver enzymes. That's what we're kind of talking about here with some of those plasma proteins. We also see that the liver is involved in the regulation of your blood glucose, just like your pancreas helps with. The liver is going to work to help regulate that. It filters the blood as a form of protection. Doing so, it's going to break down any toxic compounds that it comes in contact with. It's going to store iron and certain vitamins for a later date, especially if you have enough of it or if you need some storage of that. It does excrete bile pigments from the breakdown of hemoglobin. So when your red blood cells get recycled, we see that the iron will be stored in the liver, and then we need to get rid of the hemoglobin part that is going to be in the bile. Okay, we call this the bilirubin, and we need to get rid of that. It also is going to help excrete some hormones and cholesterol. Now, cholesterol is not necessarily a bad thing. You actually need some of it, but there's good cholesterol and there's bad cholesterol, and we have to keep those kind of in check. Then we have the pancreas next. The pancreas is going to be important in digestion, but also with the hormones because it kind of has a dual role. It's got a role in the digestive system, and then it has a role in the endocrine system. And so the pancreas does produce a lot of enzymes. These include things like amylase and lipase. They also do a deoxyribonuclease, which is going to break down the DNA from the food that you ate. And so there's a lot of stuff that's going to be produced enzyme-wise. This is all packaged in what we call pancreatic juice. This is going to be delivered to the small intestine, which is going to help then with that continued digestion of a lot of food. Now, it does contain a lot of enzymes, and it also contains a buffer because the stuff coming from the stomach is going to be acidic, and the intestine doesn't like that. So the pancreatic juice will buffer that and make it more neutral and to allow digestion to continue. We also see that the pancreas, because it has that endocrine system function, is going to deal with blood sugar. So this is going to be where we see hypoglycemia and hyperglycemia. So we have hypoglycemia, which is decreased or low levels of sugar in the blood, whereas hyperglycemia is going to be high levels of sugar found in the blood. Now, the way that this pancreas is going to help is the regulation of those two hormones I talked about earlier, which is insulin and glucagon. Glucagon is going to be released if your blood sugar is too low, so that you will release some more. Whereas insulin is going to be released when your blood sugar is too high to try to bring it back down. Now, a condition of somebody who does not produce insulin correctly in order to do this would be diabetes mellitus. And we see that that is going to be what we a lot of times just term as diabetes. But it means that you don't have enough of that insulin for some reason. Okay, and there's different types, but it means that you're not properly making it or properly using it. All right, so now let's look at some of the diagnostic tests and procedures that are going to take place with the actual digestive system. And we do see that you have the Scopy examples and the Graphy examples. All right, so if we look at the Scopy, we see colonoscopy, and a colonoscopy is a visual examination of the colon. All right, and so they're going to use a camera going up into the colon and be able to take a look. You also see that it could be a duodenoscopy, which is going to be an endoscope where they go down into the intestine and look at the duodenum. We then also will see, if you wanted to see more structures, so esophagogastroscopy is going to be where we look at the esophagus and the stomach. Okay, gastro. You could even add the duodenum in on this, and you could make the word even longer where it is esophagogastroduodenoscopy. So you could look at all those structures. And again, it's adding so many of these combining forms together. We also could see a proctosygnoscopy. This is going to be going through the rectum into the sigmoid area and looking at that one directly. And then you have the pyloroscopy, which is looking specifically at the pyloric area of the stomach. On the other hand, we have the Graphy examples. Okay, and when we're looking at Graphy, this is going to be radiologic imaging. And so Scopies, we're using like a camera or a scope. Graphy is going to be using radiology type imagings for this. So you have cholangiography, which is going to be taking a look at the bile ducts. That is the connection of the gallbladder to this small intestine. Cholecystography is going to be where we're looking at the imaging of the gallbladder specifically. Pancreatography is going to be looking at the pancreas. Salivography is going to be looking at the salivary glands. Again, using all types of radiological imaging. Some digestive system pathologies that we want to talk a little bit about. Some examples are going to be things like anorexia nervosa. Anorexia nervosa is sometimes life-threatening because it is an illness that is due to self-induced starvation. And so in this case, anorexia means that you're not eating, but the nervosa part tells us that the brain is a factor in this. And so this is a psychological disorder where the individual thinks we're fat, doesn't want to eat, and so because of that, starvation does take place. This is typically going to happen in females more often than males, and adolescent females are at a very high risk for this, and it is a type of eating disorder. We also have celiac disease. This is an inability of the individual to digest gluten, right? And so they're not able to digest gluten properly, and it causes a lot of discomfort and issues in their digestive system. We have dyspepsia, which is difficulty with digestion, and so it can be painful in that process. Dysphagia is difficulty swallowing. You have hematemesis, which is going to be vomiting of blood. All right, so the hemata is the blood, emesis is vomiting. So this indicates a lot of times that there's some sort of bleed in the GI tract, specifically in the upper GI, the stomach, maybe due to an ulcer or damage to the esophagus. So these are just some of those examples. Now, if we look at the upper GI tract, there's some other ones that we would see, like aphasia, which is an issue with speaking. And so that's going to be not being able to control your tongue, as well as part of maybe your respiratory system. And a lot of times that's going to be more of a neurological issue, but we do see that that could be part of it. Stomatomicosis is a fungal infection in the mouth. A lot of times this is the culprit of thrush, or a type of yeast infection that takes place in the mouth. Glossopyrosis, which is kind of a burning of the mouth or the tongue. Chylosis, which is kind of the splitting of the lips that can take place. Periodontitis is where you have inflammation of the part of the mouth that supports the teeth. The periodontium that supports the teeth and the connection of the teeth, that's inflammation of that area. Leukoplakia is a precancerous, slowly developing change in the mucous membrane that's characterized by white patches. These white patches are going to be kind of raised, and they're found a lot of times on the genitals or the lips or in the mouth on the mucosa membrane. Esophageal achalasia, which is also an abnormal condition characterized by dysphagia. So they've got a difficulty with swallowing and there's an issue with the lower esophageal sphincter. It doesn't relax, and so regurgitation tends to occur here. Sometimes changes in the diet or certain drugs might help with this, but the whole idea is they're going to have to dilate the esophagus in order to be able to allow the food to enter into the stomach. The next one is esophageal varices. This one is going to be enlarged swollen veins of the lower end of the esophagus. And they are going to be, because they're enlarged and their veins, they could rupture and cause hemorrhaging to occur. We also then have gastroesophageal reflux disease, and this has an abbreviation of GERD for short. This is a dysfunction of the backflow of your digestive juices that are in the stomach. So a lot of the stomach acid coming back up. We sometimes call this also heartburn or acid reflux. And then parotitis is going to be an inflammation of the parotid gland. And this is one of the salivary glands that's kind of over here by the ear. So it's a specific salivary gland that gets inflamed. So again, these are just some of the examples of some of the disorders or pathologies that will be found in the digestive system, specifically the upper digestive system. Now, in the lower digestive system, we also have some of these pathologies that could be present, like an appendicitis. This is inflammation of the appendix. Gastroenteritis, which is going to be inflammation of the stomach and the intestines itself. We also have a disease called dysentery, and this is the inflammation of the intestines specifically, and it causes issues and disruption in the digestive process. Diverticulous or diverticulosis. This one is specifically inflammation of the colon. So lipopenia is a deficiency in fat. Now, we also can have some things that are going to cause intestinal obstructions, where stuff's going to block the intestine and the food and the movement of food. Some of these include adhesions. So an adhesion is going to be where like the two sides are going to end up kind of like sticking together. This happens a lot of times after surgery, where like you've cut open different layers and then they adhere back together during the healing process. You can also have an inguinal hernia, and this is where a piece of the intestines pokes through the abdominal wall, the muscle, and it can cause like a kink in that small intestine. So that could be part of it. Intussusception is going to be where the intestines kind of like folds on itself and creates almost like this telescope-like folding back, and again causing it to kink up and not be able to send the food forward. We also see that there could be polyps that form. And a polyp a lot of times is going to be where it's got like a concentration of cells kind of growing, and it's like the beginnings of a tumor or precancerous cells. And so those need to be checked out if they start to form. We also have the mesenteric occlusion, and this is going to be where there is an actual stop of blood flow to the mesentery, which is the netting that holds all of your small intestines together. And this can be very painful, and it can be life-threatening because it can cause the bowels to start to die if they are not getting the blood flow that they need. Of course, we can have neoplasms or tumors, cancers of the intestine, which can then cause a tumor to block the flow of food and the digestive process. And then we can also have a volvulus. A volvulus is going to be where the bowel folds back on itself. Again, causing there to be like a kinking up of this tube-like structure. All right, so some pathologies that deal with the liver, the gallbladder, and the pancreas, as well as the salivary glands. For the liver, we see things like cirrhosis. This is a chronic progressive liver disease. It's characterized by the liver cells eventually not doing their job anymore, and they become increasingly resistant to blood flow through the liver. There's a lot of things that can cause cirrhosis. Of course, chronic drinking is one of them, but hepatitis can also cause this. Hepatitis is an inflammation of the liver, and it's going to be characterized by jaundice, causing the yellow coloration of the skin. It can also do hepatomegaly, where we have an enlarged liver. It can cause anorexia, where you don't feel like eating, and also abnormal liver function. This ultimately can affect the stool color, so then your stools or your feces start to have more of a clay-like color to them, and your urine starts to be more tea-colored instead of yellow. We do see that with hepatitis, there are some types of viruses that can cause this inflammation of the liver, but we also see cancers and different types of tumors can also be part of this. Hepatoma is an example of that. Hepatoma is a tumor of the liver. We also see hepatomegaly is again enlarged liver, and then jaundice is that yellow coloration of the skin due to a backup of bilirubin, because it's not able to leave the liver in the bile like it's supposed to. Now, if we go with the gallbladder, you have cholangitis, which is inflammation of the bile vessels. You have cholecystitis, which is going to be inflammation of the gallbladder itself. You can also end up seeing that there are gallstones that develop in the bladder. This is known as cholecystolithiasis, where we have actual gallstones building up. And these stones normally are going to be where they're actually blocking the bile duct, so the bile cannot be released into the small intestine. And then cholelithiasis is again the stones actually being in the gallbladder itself, in that pouch. Now, of course, most of the time if gallstones are present, you're going to have to get that gallbladder out. Then we have the pancreas. The pancreas, we can have pancreatolysis, is where the pancreas is being destroyed. There are going to be stones developing in the pancreas, and then pancreatic carcinoma is a type of cancer. We also can see in the salivary glands, you can have sialadenitis, which is inflammation of the salivary glands. Sialolithiasis, which is going to be stones also developing in those salivary glands. All right, so then we have some surgical and therapeutic interventions. These are things that can be done in order to help correct some of the pathologies that we were talking about. And so if you take a look, you can see that you have digestive tract examples and you have accessory organ examples. Esophagomyotomy is going to be where they go in and they want to try to, like, if the esophagus is constricting, open it back up. You could also have a gastroplasty, which is like a surgical repair of the stomach. We could also have a gastropexy, hyperalimentation, an ileostomy, a colostomy, diverticulectomy. So we've got these over and over again where we can go in and surgically repair or treat these areas. With our accessory organs, we can see that you can use an extracorporeal shockwave lithotripsy. That's going to be where they use the sound waves or the laser to break up stones. We can also see that they could end up taking out the pancreas in a pancreotomy. So we've got lots of different examples of the surgical and therapeutic interventions here. And you can look at them more detail in your book. When we get to the pharmaceutical side, when we're looking here, there are some examples like antidiarrheals. These provide relief against, of course, diarrhea, reducing the intestinal motility, inflammation, and loss of fluids that happen because of this. Antiemetics are going to prevent or alleviate nausea or vomiting. We have antispasmodics. These are going to be things that are going to help reduce the spasms that may occur in the different muscles of the digestive system. Purgatives and cathartics, these can be classified as either mild laxatives or where you actually can purge out the system. And so these are some of the different medications. And last but not least, you need to review again at the very end of the chapter the different abbreviations that are present. And so these are all located, this is not all of them, but they are located at the end of the chapter. So you have things like EGD, esophagogastroduodenoscopy. Okay, so that's going to be looking again at the esophagus, the stomach, and the duodenum. We then see ESWL, which is the extracorporeal shock wave lithotripsy. We have ERCP. We talked a little bit about GERD. And then IBD, which is like inflammatory bowel disease. And so we have a lot of these different abbreviations that you see again throughout the chapter. Now guys, this again doesn't go through everything that is found in the digestive system chapter, but it at least gives you kind of a foundation of some of the terms and how they work. If you have any questions, please let me know.